Good morning. Good morning to all. I will do a presentation in English because I'm sorry, but I don't speak Romanian. The alternative was Italian. Thank you very much for being here. Thank you for inviting me today to BTL. I am today to present a very breakthrough technology from Italy that is very effective on tissue repair. We are Ewa Medical. We were born in 2011, and for many years we invest in time only in research. And over the first 7 years, we conducted many studies at leading Italian university. And during that time, we published many randomized and double-blind studies that you can check already on PubMed. Today, I'm presenting a very cutting-edge technology. The name is lymphatherapy. And the lympha is the technology that accelerates the cell repair. We could define lympha like a cell stimulator because by 29 different sequences of complexes, variable, and pulsed magnetic fields with the sum of characteristics that in the good presentation of the Professor Essa she presented before, we are able to open and close selectively specific ion channel and that allow us to change the electrochemical imbalance at cell membrane level. We conducted many studies, especially in University of Rome, University of Florence, University of Ancona, University of Verona. And we published many studies. We have more than 150 pages of studies on fibromyalgia, on carpal tunnel, on osteoarthritis at knee, osteoporosis, and bone healing delay. All our evidence are able to be downloaded, a specific link in our website. So if someone of you would like to go in depth, it's possible to download the clinics. At the moment, in Italy, we have more than 350 clinics that already are using the device. We have in the north, in the south of Italy. And over the last 2 years, we started to sell outside. We have a distributor in the Czech Republic, in Slovakia, in Qatar, in Middle East, in UK, in Ireland. And in the 15th of May, or the last May, after 3 years, we got the FDA for US market. Our focus is not in sport, but we are very effective on some pathologies where there are no many other solutions, because our goal is not to work on pain with the classical medical physical therapy, but our goal is to work on the cause, on what to produce the pain. So when we reduce the pain is because we were able to reduce the inflammation or the edema that produce the pain. The first team in the world that started to use lymphatherapy has been Real Madrid in 2019. The second has been Manchester City, and in Italy now the most important, like Juventus, AS Roma, Lazio, Inter Milan, and recently AC Milan too, they use a lot of lympha. They use especially on bone edema, stress fracture, articular pain, and on the tendinous for overuse, like groin pain. We helped some important athletes in tennis too. Of course, I think that you know very well Sasha Zverev, that is number 2 or 3 in the world. I don't know if now it's 2 or 3. Sometimes it's 2, sometimes it's 3. But last year, during the Wimbledon, he had a bad bone edema at his knee. And someone told to him that there was a very innovative Italian device that was very effective on bone edema. So he contacted us, and we did the lympha for 10 days, twice per day. We treated him with a program for inflammation, edema, and pain, and with another product for tissue repair, for bone repair. And after 10 days, he participated at tournament of Hamburg. It was very important for him because he was born there, and he lost in final. So he used a lot of lympha. And last year, we started a collaboration with Jasmine Paolini. She's number 4 in the world, and she travels always around the world with lymphatherapy with her. So lympha, we don't focus on pain, we focus on regenerative medicine, but we are able to work on some on the most important osteoarticular pathologies, rheumatology, traumatology, and fibromyalgia, and we are very effective not only in acute and subacute phase, but especially in chronic phase. after I explain which protocol we use. But we are very unique on tissue repair because we have studies on bone, muscle, tendon, and cartilage. The principle is to stimulate the opening and closing of specific ion channels, and we obtain this by an external oscillating field that is able to open and close specific ion channel. We could compare lympha like pharmaceutical drugs, because you know that drugs, you produce drugs by the ingredients. Our ingredients are the 29 sequences that we patented. By the sequences, we develop specific program. So we have a program for bone, another for connective tissue repair, another for muscle, another for inflammation. And inside each of these programs, we did only the sequences that we are know that are very effective for the specific pathologies. And you know that ion channels are very important. For example, if you want to work on bone, it's important to stimulate the ion calcium. If you want to work on inflammation or edema, it's important to work on potassium, sodium, and others too. On the left, you see which is the electrochemical balance when the cell is healthy, sorry. In the middle, when is sick. And what we do is to restart the right ion polarity balance. We work with very, very low frequency because we work under 80 Hertz, under 100 microtesla. We use this frequency and this intensity because our goal is to communicate with cells. So we help cells to accelerate their self-repair, because you know, for research, that cells are capable to send with each other specific self-repairing messages. So what we do is to accelerate that process, and that allows us to reduce over 50% time the healing time. So the frequency and intensity are only two of the characteristics of our sequences, because only frequency and intensity are not enough to stimulate that results, but it's very important to mix that frequency, that intensity with specific laying, specific shape, and specific polarity. And we mix during our program always, many times, these different sequences. So before or after, inside specific program that lasts on average 20 minutes, we find the right sequences for everyone. And we have an effective around 75 to 80%. You know, to compare lympha, to explain, because when we speak about magnetic fields, the first question is, okay, is like magnetotherapy? No, not because, because magnetotherapy is no good, but because it's different. Because you know that magnetotherapy is simple, is able to use only one signal that is simple with different wave. This is instead a specific frame of our stimulation, when you can see that our sequence is always different for frequency, intensity, length, shape, and polarity. You could compare, I don't know, if you think a bank, in the bank there is a safe bank. To open the safe bank, you need a combination. Our sequences are able to open 29 different doors, the doors that we want to open are the ion channels. And we know that in 75 to 80% of the cases, if we launch a specific program, before or after, we find the right sequences for everyone. For this reason, it is impossible to interrupt the program. With magnetotherapy, you can stop and restart when you want, because the stimulation is always the same. Our program, if lasts 20 minutes, you have to play all the program, because it's impossible to know before the treatment which are the right sequences for me or for you, and the right sequences for me today is not sure that will be the same next year. How to use lympha? We start from the point that physiotherapy starts from physiotherapy. So what we can do with the medical device is to support the manual therapy, and we can do this before and after the manual therapy. In the phase that we call phase one, when there is acute pain, when there is a swelling, we are able to work immediately after trauma. We work with implants. We don't have any type of situation when we can't work. But in that phase, I know that you have a lot of solution. What lympha can have is that lympha is a cold therapy, so we can work immediately after trauma when there is a lot of swelling, a lot of inflammation. Our goal is not to remove, to relieve pain relief, but to reduce the inflammation, to edema, and that allow to accelerate the tissue repair, allow the physiotherapist to start before in a normalization situation with the manual therapy to the patient. Usually, to work on acute phase, is enough to use 3, 4, or 5 treatments. When you have to work on chronic pathologies on tissue repair, you need to stimulate the tissue for at least 3 or 4 weeks. So the best indication is to not treat the patient every day, but or every other day, or two treatments per week. Because if you follow a protocol of 10 or 12 sessions with this frequency per week, you will have stimulated the tissue for at least 4 weeks, 3, 4 weeks. That is the right time that you have to follow to respect the biological timing. Of course, any tissue have different timing to respond. For muscle, we have result in 15 days. On bone, 4 or 5 weeks. And now I show you some studies. And on cartilage, of course, you will have some result after 1 month and a half by clinical examination, but you would repeat MRI after 5, 6 months. Before that time, is impossible to see any evidence. The device is completely automatic. That is very important because by this we are able to standardize the result. Inside the device there are 2 channels, so it's possible to treat or 2 different patients at the same time or 2 different zones of the same patient. For example, a shoulder or knee. We work by an emitter. Inside the emitter there are 3 coils, and we produce a closed loop field that is similar like a rugby ball. That allow us to arrive 18 centimeters in depth. So we are, for example, more effective on hip, because 18 centimeters is a big range, and if you have a problem at 3, 4, 5, or 10 centimeters, before or after, we are able to intercept. Inside the device, there is pre-installed a manual of protocol, because for every pathologist, we develop a specific protocol, and by that protocol, we develop the studies. So we validated not only the effectiveness, but the therapy. And for every pathologist, we can use different programs. There are 7 programs that we developed by the 29 sequences that we patented. The program that at the moment on the device, that in the future, of course, could be upgraded, are analgesic, anti-edema, anti-inflammatory, muscle relaxant, neuromuscular repair, bone repair, connective tissue repair. There is an index, so every pathologist have pre-installed a specific protocol. For example, for hip post-prosthesis, the program that we recommend is automatic program. That is a combination of analgesic, anti-inflammatory, anti-edema, and we recommend 10 sessions with the frequency or every day or every other day. And you have to put the emitter over the part of the body that you have to treat. We have another example on hip arthrosis. In acute phase, we start always with automatic, because automatic prepare the second phase. And in the second phase, we use for arthrosis and hip, the connective tissue repair for 50 sessions every 48 hours or 72 hours, for the reason that I explained before. For epicondylitis, for example, the same approach. For gonarthrosis, we have for all pathologies. When we have to work on systemic pathologies like rheumatoid arthritis, or like DOMS, or like osteopenia, or like fibromyalgia, we use a MET. Of course, emitter is more concentrated respect to MET, but with the MET we are able to cover all the body. We are very effective on bone density, so we are very effective on the treatment of osteopenia and osteoporosis. For osteopenia, we use the MET. For osteoporosis, we use the 2 emitter that we put before on the head of femur and after on the back. Always with bone repair program. The duration of that program is only 27 minutes. Now I show you some abstract case report. This is, Okay, this is a story of bone healing delay when we reached an effectiveness of 89%. The study was very important because we treated a patient with, in that case, for example, male, 42 years old, pseudoarthrosis at femur, 28 months after acute event, 28 months, it means that without any other stimulation, the situation will be the same. And on the right, you have T2 after only 5 weeks of lymphostimulation. The protocol we used was 50 treatment with 3 treatments per week. And every treatment the duration of every treatment was only 27 minutes. In other case, male, 37 years old, pseudoarthrosis tibia fibula, 9 months after acute event, T1, and after only 5 weeks, with 3 treatments of 27 minutes per week. Okay. In this case, we have a male, 52 years old, with delayed femur consolidation, 4 months after acute event. The patient was in wheelchair. In the middle, we have after only 5 weeks. And on the right, you have the follow-up after 3 months. Because after the last stimulation, the stimulation of the bone goes forward. We have a biopsy of mandibular bone. We have 2 samples of the same patient, of course. On the left, we have the bone without lymphostimulation. On the right, we have stimulated by lymph. It's completely vascularized, and usually that level of vascularization, the bone reached after 6 to 8 months. We reached it after 2 months. Here we have another very, very good study that we conducted at University in Flores in 2023. It's a study on cartilage in vitro. We repeated that study 3 times. You can check already on PubMed. And we started from mesenchymal stem cells. We put that mesenchymal stem cells inside the box, and we treated by lymph, by an external, by an emitter, because we are able to work on cast too. So that's no problem that mesenchymal stem cells were in a box. And we treated with the connective tissue repair program. The goal of the study was to verify if our stimulation was able to stimulate differentiation to cartilage. So we observed some specific chondrogenic marker. The most important were collagen type 2 and collagen type 1. You can observe in the 2 tab always the 3rd and the 4th column. On the left, we have collagen type 2. Collagen type 2 is the good collagen, because you know that muscles, tendon, and ligament are made by collagen type 2. So the goal here was to increase. And we increase over 100% the differentiation to collagen type 2. On the right, you have what happened on collagen type 1. Collagen type 1 is the fibrotic tissue. So the goal was to decrease the differentiation, and we decrease over 100%. So it means that lymph is able to accelerate the tissue recovery, but is able to stimulate the recovery with a very good tissue. So if you use after procedures like PRP or stem cells, lymph is able to activate cells and improve the effectiveness of the treatments. To support this, we conducted another randomized double-blind study on osteoarthritis at knee. This study is already on PubMed 2, when we reached an effectiveness of 78%, only with lymph. Another study on osteoporosis, when we conducted a pilot study at University of Ancona. We observed some specific items. On the right, you have the T-score, and after 6 months, we reached a T-score of 17.4%. That level of T-score, usually by drugs, pharmaceutical drugs, you reach after 1.5 years with a lot of side effects. We reached after 6 months without any type of side effects. And in the meantime, we observed 2 other indexes that are BMD. BMD indicates the concentration of bone density per centimeter, and TIBS. TIBS is a quality index because it refers to trabecular bone score, and it means that we were able to maintain flexibility of the bone. That is a side effect of the patient that use drugs. So that protocol on osteopenia and osteoporosis could be right for all people to integrate with pharmaceutical drugs, for all people that are doing this, but could be a very important solution for all people that don't want to take drugs or can't take drugs. It could be an opportunity for women to prevent especially after menopause, during the osteopenia phase, when in that phase they don't do nothing to prevent the osteoporosis. We got FDA, as I said before, in 15 May, and our next distributor in US will present Lympha like the first device in the world effective on osteopenia and osteoporosis treatment except pharmaceutical drugs. Now I'm arriving to the end, but I would like to present you some cases regarding what Lympha is able to do on bruise and soft tissue. This is a bruise. We have on the left below before and after only one treatment, and you can see in session 2. You have before and after. You can see especially at the forefinger that is completely changed the color. This is an ankle sprain. On the left before and on the right after 2 days. We were able to reduce the circumference of 4 centimeters less, and that could be very useful for the physiotherapist because can start before with the situation that is more normalized and the patient is more collaborate. The last case report is a finger after being immobilized incorrectly. This is a cancren. What we said is we treated him only with Lympha. The first treatment was 1st October, 9 October, 14 October, 21 October, and 4 November. In 5 weeks, we closed the wounds only with the Lympha with 2 treatments per week. Thank you for your attention.